Hi, welcome everybody. My name's Kath McIntyre. I'm from the Australian Telehealth Society. Welcome to everyone here today. I'd first like to acknowledge that we meet on the land. I'm actually meeting on the land of the Kaurna people of Adelaide Plains, and I pay my respects to elders past and present, and I extend that respect to any other First Nations people with us today. I am in conversation with Sally Cashman. Hello, Sally. Thank you for joining me. So,
Pleasure.
Sally is a virtual care support officer who has a background in physiotherapy and has worked primarily in inpatient settings in public health and in home visiting rehab. So we thought it would be a really good opportunity to, in these conversations, to just do an update on the speakers and presentations who did a talk at the Success and Failures in Telehealth Conference in 2022, and we could catch up with them for an update on their work. So thank you, Sally, for coming and talking to us today. Could you just tell us a little bit more about what you do, first off?
Sure. So as you said, background in physio, and I've got one of my children has got a medical condition. So in the pandemic, I sort of fell into doing some telehealth work because there was such a surge here in Hunter, New England. And learned lots on the fly. So I now am very lucky to have a permanent role in supporting virtual care to happen within Hunter New England Local Health District. So my role is very varied. I have some direct patient contact because we have a telehealth support number that the public can call into, but I primarily spend most time supporting staff with how to use virtual care as a tool at that disposal when they see fit.
And can you tell me a little bit about what you did present at SFT last year, what your presentation was?
Yeah, sure. So I presented about challenges or overcoming challenges in regional and rural areas with telehealth. So H&E has a very large geography, and I guess a couple of the more recent strategies that we've used to make telehealth accessible for everyone are having, we call them patient telehealth suitable rooms. So we've essentially set up at nearly all of our Hunter New England facilities that there's a room that is suitable for a patient to go into and do their telehealth from. So if they're not able to do it from home. So, it's just really a clinic room that has a computer with a camera and speakers, and that there's some staff that are happy to, receive the patient and go and show them to the room, log into the computer. We use My Virtual Care, so they just enter the appropriate My Virtual Care waiting room, and then they can leave the patient there to do their consult. So, I guess we have some patients that either don't have the tech and the know-how to do their video from home, or they might have issues with their internet. Like I had one bloke say he would have to get on the roof of his house to try and get reception. So, coming into a centre that he's got to go into town for the shops, for shopping anyway, sort of. And then I guess some of the staff at these facilities, it really helps them to, keep their finger on the pulse with some of these community members. And I think it's also, as well as providing the tech and the know-how, it's providing a bit of support to that patient, because sometimes, if people are alone, they have a consult and it's almost like they come out and just need to have that little bit of time to, gather their thoughts about what's just happened, have a cup of tea, or debrief a little bit, or just know how to be linked in to their health needs. So we're finding those rooms are getting really well used. I think the other strategy that we've used of late has been QR codes. So we decided to make QR codes for all of our My Virtual Care waiting rooms. So hopefully for people that are using mobile devices, which is many, a QR option can make it a little bit easier for some people to go to a website. people are just used to QRs from the pandemic. So I've actually got a little postcard here that was, or I'm thinking I'm blur, but yeah, essentially we made a postcard that's got a QR, and we had a great suggestion from one nurse who said, look, it's great to have a QR for every waiting room, but can you do one that gets the public to sort of a whole list of a waiting room? So that's what we've done on this postcard, just to try and flag up to people that we offer virtual care. Here's one way that you can get access to get into any of our waiting rooms, obviously if it's a scheduled appointment, but these are really handy for, say, community nurses that are out and about, for aged care facilities, because they, either staff have personal phones or they have tablets. So it just means that it doesn't have to be the email sitting in the right inbox. It can be a QR on a postcard, in a book, on a wall that someone, a staff member could go up and scan to get access. So yeah, that was, I guess, those sort of more novel strategies and examples of how we're using them. That was pretty much what I focused on at SFT last year.
When did you bring in the QR codes?
Goodness me, we only did the postcard sort of earlier last year. We have created QRs, maybe even, goodness, another year before that potentially, sort of just as we create waiting rooms, we sort of make a bit of a suite of, like an email template, and we do make the QRs for each service. So some services like to do, even like just a small slip of paper that's got their specific QR so they can leave with their patients when they see them in person. But the postcard was just last year, and the postcard's something that we've tried to get out just to the general population, so that, those patients that might have a telehealth with one service, but then they're also doing a telehealth with a different service. That means for those patients, it's easy because they can get into any of the waiting rooms from that one spot. Yeah.
Did you have any barriers to bringing in the QR codes, just out of interest? Was there a kind of, an education part of what you had to do?
I think sometimes it's just a little bit of explanation needed about when the QR is going to be useful. So, like a lot of telehealth appointments, the patients receive an email with their appointment details, and just sort of explaining, if you're happy to use email and you're on your computer, you're not going to use a QR because you're already on a device. So just that little bit of explanation around, it's for people that you see in person, and you can hand them the postcard, or you can send them a letter because perhaps they don't have an email address, but that doesn't necessarily preclude that person from doing a video consult. And yeah, I think maybe it's a great strategy that some staff find they can use, because we've been working with the hospital in the home teams of late. When they go into a home, they can sit with the patient and almost do a bit of a practice with the QR, and then say, okay, we figured out how this works. Maybe tomorrow, let's you and me do a video. And yeah, they've been able to use that QR to help the patient set up when they're together, and then step away and then do their virtual consult a couple of days later.
Yeah, that makes perfect sense. Has there been any other barriers that you've had to come up with solutions for in the work that you do?
Possibly one that I guess just with some of my notes here, I thought with those patient rooms, we had some staff that also wanted to do virtual group sessions. So, where they've got a group of patients, sort of mimicking, maybe a mental health session that they would normally do with a group of patients, or an exercise session. We've got some stroke services looking at doing some outreach. Those patient rooms, because we'd arranged that staff could sort of use a generic login, so they weren't leaving there walking away from the computer with themselves logged in individually. That sort of made it a little bit tricky about what systems were accessible on those in those patient telehealth rooms, because a lot of services for our in H&E use Teams for groups. So yeah, we had to do a bit of problem solving around how can we make these rooms usable for the groups. And actually, like one service, for instance, have ended up using PEXIP rather than Teams because we could facilitate the use of PEXIP in that patient telehealth room. And I guess similar, or in that same sort of theme, we have had some staff say that some patients that might not have as much tech know-how had been finding Teams a little bit trickier to connect to, you know, like because they might have needed to install an app and so on. So again, yeah, we've got a couple of services using PEXIP instead because they've found it was a bit easier to support the patients to connect. And for us as telehealth support, we could easily get into the PEXIP meeting as well and sort of do a bit of support and then step out. So yeah, I think it's great. Like I really find it great that there are a few different systems that are all supported that we can try and meet the needs of the service and the patient and then figure out what, you know, video conferencing system matches best to what they need to do. So yeah. I feel like I've got a lot more video conferencing knowledge now than I certainly had a couple of years ago.
Yeah, I bet you do. You would be an expert on quite a few platforms and kind of, you know, the way to do it with a certain, I imagine the way that suits a certain patient and a certain demographic. Yeah. And what's the next steps for you, Sally?
As I said, we've been working with some hospital in the home services, so that will continue. We've got a few different HIF services in H&E, so really trying to support them with education, capability, equipment, and then how they can take advantage of that to, you know, use virtual care to maybe create a little bit more capacity in their services. Where I'm supporting like education for allied health that might be involved in palliative care or end of life sort of situations. So yeah, got a couple of good opportunities to flag up telehealth to allied health across the district upcoming in the next few months. We're also sort of trying to help reinvigorate that contact with aged care facilities and, you know, their residents that have either H&E outpatient appointments or they might have a emergency sort of, you know, like emergency care need, and just trying to reinvigorate the option of video there. So again, lots of staff education. Yeah, so that you know, staff really need to feel comfortable at saying, I think a video is appropriate and I know how to use the tech. So there's you know, one nurse that's really working very hard with outpatients, orthopedic outpatients, to just prevent those residents from coming in unless they absolutely need to. Yeah, lots of good stuff. Our virtual kids team are doing wonderful work supporting kids and families sort of across H&E, again, with that ED avoidance. So yeah, I think we've got staff that are really maturing in their use of video conferencing and you know, we'll be looking at the remote patient monitoring options soon as well. Yeah, which I think people are getting excited about, but it's just figuring out how it's going to help and who it's going to be useful to. So yeah, lots of work coming up.
You're doing a lot. So out of all that, what gets you the most excited?
What was that? Sorry, Kat?
Out of all that, what gets you the most excited?
Oh, I don't know. I don't. I do. I think the HIF work, because I have done a lot of work in the community. I know that when people get to stay in their homes and stay local, they seem to recover really well. How important it is. Yeah. So, and I think also when staff are a little bit hesitant and when they have some success, we had one on Friday, it was really nice with a HIF patient like that. Yeah, that feels really good when you know, when staff have put time and effort into learning something new, and when it works out, that's really good to see, because it's a different way of working, and it's a big change for a lot of people. So that's rewarding when you know that it's made a difference, because staff feel capable and the patients feel like they've really benefited from having that choice.
And one last question, what do you think, the fundamentals of telehealth is? Because it has to be easy to use, there has to be, support there, of course, for the consumer or for the nurses that are using it. What do you think is, what do you think that if you had to pick kind of 3 fundamentals, what would that be?
Gosh, I think like I've been loving just recently being able to steer people to the 8 principles that have just come out on the ACI. Like, that's been a great starting point, I think, for individuals as well as services, about what to consider. But I think you sort of highlighted it, Kath. Really, there needs to be communication at some point with the patient, really, about, can you do this? Is this right for you? Mm-hmm. In terms of having access to gear and know-how. I think I really want staff to consider it all the way along, and I guess not always have that consideration about, is it clinically appropriate, even if it's not really my jam to do video, but if I feel it's appropriate as a clinician and the patient is going to benefit from it, to offer it. But I think the systems that we use, they've got to be user friendly, because time's so precious, isn't it? And we don't get a lot of education opportunities with staff, so to be able to set them up quickly, have support available, it makes a real difference with whether or not staff are going to use it and see it as something that's effective, and makes their life, their working life, more efficient, not more difficult. We need to be making things easier.
Yeah. Well, thank you for the update. Are we going to see you at SFT in the future?
Oh, not this year, because I've been very lucky and I've been to a few other conferences over the last little while. But I certainly would love to again in the future. I know Carla Sunner's there for us, flying the flag for aged care, so that's wonderful. For sure, again in the future.
Great. Well, thank you, Sally, so much for talking with us this afternoon. I really appreciate your time and all the great work you're doing. Thank you.
Pleasure. Thanks for the opportunity.
Thank you.